Good morning, everyone. Today, we are going to explore two fundamental concepts in health marketing: targeting and positioning, and how they guide the delivery of sexual and reproductive health, or SRH, products and services. These ideas help us answer key questions such as, who exactly are we trying to serve? And how can we present our services in a way that resonates with them? To set the stage for this discussion, let's clarify what we mean by targeting in the SRH context. Targeting in SRH marketing is a strategic process. Rather than trying to reach everyone with a single approach, targeting requires us to identify distinct segments of the population. For example, adolescent girls seeking menstrual health information, men needing STI screenings, or refugees facing access barriers. Reach the most suitable and receptive groups, meaning those who are most likely to benefit from, engage with, or respond to the service. Focus efforts on those with specific needs, whether it's contraceptive counseling for young couples or prenatal care for underserved communities. Think of targeting as adjusting a camera lens. Instead of a blurry picture of the entire landscape, we zoom in for a clearer, more relevant focus. Now that we've defined targeting, the next logical question is, why invest so much effort in this process? What advantages does it offer? A primary benefit of targeting is efficiency. By narrowing our focus, SRH providers avoid spreading resources thinly across groups who may not need or want the service. Targeting also enhances tailored relevance. When services match the audience's lifestyle, beliefs, and barriers, the offering becomes far more meaningful. For example, a digital contraceptive reminder app may be highly effective for young youth, but unsuitable for older clients with limited smartphone access. Another crucial advantage is improved communication efficacy. Messages can be designed with cultural nuance, language sensitivity, and appropriate imagery. A campaign promoting safe childbirth practices might use community radio in rural areas, but Instagram Reels for university students. On the slide, you can see a perceptual map illustrating how clients judge products based on attributes such as price and quality. This reminds us that targeting is also about understanding what matters most to different groups. Building on these advantages, let's consider the broader impact targeting can have on service delivery and community health. Targeting supports resource optimization. By focusing on segments with the highest need or readiness for behavior change, organizations reduce wastage of funds, time, and effort. Another major benefit is client satisfaction. When services reflect clients' realities, such as multilingual staff, youth-friendly spaces, or confidential counseling, people feel understood and are more likely to return. This ultimately leads to better health outcomes. By connecting the right people with the right services, we can reduce unintended pregnancies, improve maternal health, and increase early detection of STIs, strengthening overall community well-being. Having seen the value of targeting, our next step is to understand how organizations actually implement this process. The targeting process follows a clear workflow. Segmentation, dividing the broader population into groups that share similar characteristics, age, location, behaviors, risk levels, or cultural background. Market research, gathering detailed information about the chosen segments. For example, research might reveal that young mothers prefer evening clinic hours due to daytime childcare responsibilities. Positioning. After understanding the segment, the service is differentiated to appeal specifically to them. Positioning shapes how clients perceive the offering compared to alternatives. With this structure in mind, let's look at the different strategic approaches organizations use to carry out targeting effectively. There are several ways to approach targeting strategically. Geographic targeting, focusing on specific locations, such as remote areas with limited maternal health services. Channel targeting, using communication platforms preferred by each group. Youth may respond to TikTok videos, while older adults may prefer community radio or announcements at local gatherings. Message tailoring. Crafting messages that speak to the audience's values. For newly married couples, the message might emphasize planning for a secure future. For adolescents, the focus may be on privacy and confidence. Partnerships. Collaborating with women's groups, youth clubs, or community-based organizations can increase acceptance and access. However, as we target specific populations, we must remain mindful of the ethical responsibilities that accompany this work. Because SRH involves sensitive and personal issues, targeting must follow strong ethical principles. Avoid stigma. Messaging should not isolate or blame groups. Privacy. Protecting the identity and data of clients is essential, particularly for services related to HIV testing, contraception, or gender-based violence. Informed choice. Clients should make voluntary, well-understood decisions without coercion. Inclusivity. Services must be accessible to people of varying abilities, backgrounds, and identities. A key component here is confidentiality. Confidentiality means safeguarding patient information legally and ethically. No details may be shared without explicit consent. In SRH settings, this trust is crucial, especially for adolescents or those seeking discreet care. With the ethical groundwork established, we can now shift to the second main concept of today's lecture: positioning. Positioning is about establishing a distinctive image and value proposition in the minds of your market. In SRH, positioning helps communicate what makes your service unique, why it matters to the client, and how it meets their needs better than other options. For example, a clinic may position itself as the most confidential, youth-friendly reproductive health service in the district, emphasizing privacy, respect, and ease of access. To understand positioning more deeply, let's examine the core strategies used to create a strong market identity. 3 main strategies guide effective positioning: differentiation, creating a unique selling proposition. Examples include 24/7 telecounseling, father-friendly antenatal education, or free postnatal follow-ups. A positioning statement, a concise sentence summarizing the service's unique value. For example, we provide fast, confidential reproductive health care designed specifically for young adults seeking trustworthy support. A positioning map, a visual representation that compares services on attributes such as price or quality or accessibility, helping organizations identify gaps and opportunities. With these strategies in mind, let's look more closely at specific attributes that often define a provider's position in the SRH market. 2 powerful attributes in SRH positioning are expertise and innovation. Clients seek providers with proven skill, such as experienced midwives, gynecologists, or specialized counselors. Innovation, modern features like digital appointment systems, self-testing kits, or AI-assisted triage technologies can set a service apart. Clinics emphasizing these attributes position themselves as trusted, forward-thinking providers. Now that we've considered expertise and innovation, let's turn to another set of attributes that focus on access and affordability. Accessibility. This includes extended hours, multiple locations, telehealth consultations, and disability-friendly facilities. Each element helps reduce barriers to care. Affordability. Transparent pricing, sliding scale fees, insurance acceptance, and financial assistance programs help ensure cost is not an obstacle. The benefits of telehealth graphic reinforces how virtual options can expand privacy, reduce travel costs, and maintain continuity of care. Finally, let's examine the emotional and relational attributes that deeply influence client trust. 2 final attributes play a central role in effective SRH positioning. Confidentiality. Clients must trust that their personal information is secure. In contexts where stigma is high, confidentiality becomes a defining feature of quality care.
Empowerment. Providers act as partners rather than authority figures, supporting clients in making informed, autonomous decisions about their reproductive health. And with this, we conclude our journey from identifying whom we serve through targeting to shaping how they perceive our services through positioning.